Yelling. There we go. I hear wind.
A lot of hot air now.
Yeah. Is that better?
I think you are live, so
Okay.
people are hearing you on TV and on the internet.
Here we go again. Okay, so this is the proclamation, first proclamation, Infant Immunization Week, and Jeannie Knight. Hi, Jeannie.
Hi.
Our Personal Health Division Director.
Thank you, Commissioners, for recognizing
Will you get that mic right in front of you, Jeannie? Thank you.
Sorry. Thank you, Commissioners, for recognizing the importance of infant immunizations. Giving babies the recommended vaccinations by age 2 is the best way of protecting them from 14 serious childhood illnesses like whooping cough and measles. Most of our parents do choose the safe and proven protection of vaccines. However, we are seeing an increase, in particular in the number of children under the age of 2 who receive no vaccines. Our data suggests that many of the parents do want to vaccinate their children. However, they may not have access to a nearby healthcare provider. They don't have time to take their child to a physician, or they're concerned that they can't afford vaccines. Not only are we celebrating the 25th National Infant Immunization Week, but it's also the 25th anniversary of the Vaccine for Children program, a federally funded program that provides vaccines at no cost to children who otherwise may be unable to be vaccinated because of an inability to pay. As you're well aware, vaccines are among the most successful and effective public health tools available for preventing disease and death. We talk about having to have a 95% vaccination rate in the community to prevent illness in infants, to prevent illness in immunocompromised individuals, and individuals who can't receive the vaccine, and it protects our entire community. Among children who are born during 1994 to 2018, vaccination alone will prevent an estimated 419 million illnesses, 26.8 million hospitalizations, and 936,000 deaths over the course of these children's lifetimes. Vaccinating our community is certainly a shared responsibility. Our families, healthcare providers, and public health partners must partner and work together to protect the entire community. Vaccine-preventable diseases still circulate in the United States and worldwide, and certainly our recent measles outbreaks are testament to that. So continued vaccination is necessary to protect everyone from potential outbreaks. Many of these diseases are little more than a plane or a car ride away from all of us. We talked to our parents about the ultimate baby-proofing plan of 6 steps. The first step is ideal timing. The immunization schedule is carefully designed to provide protection at just the right time based on how a child's immune system responds to vaccines at various ages and how likely a baby is to be exposed to a disease. The second step is it prevents complications. Delaying vaccines can leave a child vulnerable when they're most likely to have serious complications. Think about it like you think about the safety equipment, the bike helmets that we put on our children to protect them from serious injury. Vaccinating on schedule protects a baby from serious diseases. The third is early protection. It's best to vaccinate a child before they're exposed to dangerous diseases. We don't buckle our babies into a car seat as we're driving down the highway. Babies need a vaccination long before they're exposed to a disease. Number 4 is it's the best protection. Babies will not have the best protection from these 14 serious diseases until they get all of their recommended doses of vaccine. Just as we cover the outlets in our homes as our babies are growing up that are within their reach, every dose of vaccine on a vaccination schedule is very important to the baby's health. It provides them with long-term protection. Our maternal antibodies in breastfeeding don't provide our babies with enough protection. The protection passed to baby before birth protects them from diseases during the first few months of life, but eventually our babies' immune systems need to fight diseases on their own. Following the immunization schedule ensures that baby's immune system gets the help it needs to protect the child long term. Not vaccinating our children on time can make everyone else or someone else sick. Kiddos not vaccinated on schedule are at risk of getting sick themselves and also spreading illness to others, like newborns for who they're too young to receive the vaccines, people with weakened immune systems, or those who cannot receive vaccines for other reasons. Vaccinating our children on time helps to protect our friends and family and the community. Vaccines protect us from diseases and death. They activate our natural immune systems, and the science is clear that they are effective and safe. So thank you for recognizing the importance of immunization for our children.
Beautiful. Any questions or comments?
No, I think Jeannie's heard me say this before, that kids are 30% of our population, but 100% of our future.
They
We
are.
ought to get it right.
We've got to. Thank you very much.
Thank you.
No, ready?
I would just add that we're elected to watch out for the citizens and the people of the county, and that very much includes that special population of babies.
Absolutely.
Thank you.
Thank you.
Can we have a proclamation? Don't go away.
Well, you have a whole room.
They're all going to get to come up and have a picture.
Okay. We're ready.
Ready to go?
Yes.
Thurston County Proclamation, Infant Immunization Week, April 27th to May 4th. Whereas giving babies the recommended immunizations by age 2 is the best way to protect them from 14 serious childhood diseases. And whereas vaccine-preventable diseases still circulate in the United States and around the world, so continued vaccination is necessary to protect everyone from potential outbreaks. And whereas when people are unvaccinated, outbreaks of diseases like pertussis, whooping cough, and measles can and do return. And whereas it is important to vaccinate children on time according to the childhood immunization schedule to provide the best protection early in life when babies are most vulnerable. And whereas since 1994, National Infant Immunization Week has encouraged parents, caregivers, and healthcare professionals to participate in educational, recognition, and media events to increase the awareness of the importance of immunizing children before their second birthday. And whereas the 25th National Infant Immunization Week will be celebrated as part of World Immunization Week, an initiative of the World Health Organization. For this event, all 6 World Health Organization regions, including more than 180 member states, territories, and areas, will simultaneously promote immunization, advance equity in the use of vaccines, and universal access to vaccination services, and enable cooperation on cross-border immunization activities in April. And whereas the week of April 27th to May 4th, 2019 has been declared National Infant Immunization Week to help ensure that children should be protected against 14 vaccine-preventable diseases by the age of 2. Now, therefore, be it resolved, the Board of Health hereby proclaims April 27th to May 4th, 2019 as Infant Immunization Week in Thurston County, and encourages parents to make vaccinating their children a priority and to talk to family and friends about protecting their children with vaccines. We also encourage businesses, government agencies, community-based organizations, and service groups to spread the immunization message throughout our communities. Adopted this 9th day of April, 2019 by the Thurston County Board of Health.
Yeah. Good. Now we have
picture?
Yeah, we'll do a picture, and we have proclamations to hand out as well. How many have coming up? Everybody?
Almost everyone is.
How many do we have? Just
Well,
one
good.
to hand out?
Please
Okay.
come up front.
Bring them up here, Jeannie.
Come
You're
up
the
and
first
crowd
sergeant.
the
Get 'em
front of
up
the
here.
room.
How are you?
Both of
How's
them.
Roman
Thank
doing?
you.
Keeping you busy?
You just hold there. Thank you, Jeannie. Thank you. Show us your socks.
Burned it.
Oh, that was the previous thing. Yeah. Now, who's
Oh,
relieving?
oh,
Who's
I
receiving? Jeannie, there's one for you.
Thank you.
Who else is receiving the proclamation?
You can give it
To who?
over here.
Jennifer. There you go. Yes.
Thank you.
That was easy. Good. Yay. That was fast. The next proclamation is for Sexual Assault Awareness Month, and presenting is our PHSS Director Shelley Slaughter and Prosecuting Attorney John Thunheim. Please come on up.
Good afternoon, Commissioners. On behalf of Thurston County Public Health and Social Services, I am here to ask you to proclaim April Sexual Assault Awareness Month here in Thurston County. The purpose of this proclamation is to raise public awareness about sexual violence, including harassment, assault, trafficking, and other violent or unwanted sexual experiences, and to educate our community on how we can prevent it. The 2019 theme is based on consent, and the slogan is I ask. I ask is the statement by which individuals will demonstrate that asking for consent is a healthy, normal, and necessary part of everyday interactions. We have very many important partners working together on this issue. Last week, our Thurston County Healthy Youth Survey results came out, and unfortunately, it revealed some very disturbing information about our high school youth. 1 in 7 girls and 1 in 7 boys and 1 in 5 girls has experienced unwanted sexual contact in high school here in Thurston County. 1 in 5 women and 1 in 7 men in our community have experienced rape in their lifetime. This is a very important issue. We must work together to prevent it. We partner with many of our county partners, including our Thurston County prosecutor who is here, and many community partners who will be calling up to share information on how they are working together to prevent sexual violence in our community.
Thank you. Prosecuting Attorney John Thunheim.
Thank you, Mr. Chairman. Commissioners, it's my pleasure to be here again this week to present a proclamation with regard to Sexual Assault Awareness Month. Last week, we were here to do a similar proclamation for child abuse awareness. And I think it's appropriate, actually, that the months for these two overlap, because so much of the sexual assault, so many of the sexual assault cases that we see in our office involve youth or children. But today I think it's important also that we recognize and that we raise awareness that sexual assault can affect anybody of any age. And in fact, we see victims and survivors in our office every day of all ages who have experienced, unfortunately, some kind of sexual assault. I want to say that I think it's really important for everybody to understand that this offense, while it's called a quote-unquote sex offense, is not really about sex. This is really about power, and that these offenses occur with a motivation of power and control, which leaves victims and survivors in feeling essentially powerless or helpless, both during but also following the circumstances. But it is also about betrayal. I worked these cases for about 10 years as a deputy prosecutor. It was the primary part of my caseload. I've literally worked with hundreds of victims and survivors of sexual assault in the cases that I personally prosecuted, and I can tell you that often these crimes are very much about betrayal, where the perpetrator exploits either the circumstances of the moment or the relationship that they have, or both. And so many sexual assaults occur within that context. It's really important, I think, that the public understand that sexual assault can in fact occur with two people who are in a relationship. It can occur with circumstances beyond what's often portrayed in the media as the forcible sexual assault. And we need to have awareness of all of these different circumstances and really promote the community to hear the voices of these victims and survivors. And frankly, the media attention to this over the last couple of years, the voices that we've started to hear from victims and survivors, and the fact that the community is hearing those voices, in my mind, is a very positive move forward. And so I am here and proud to present this proclamation along with Department of Public Health, and I will yield the microphone to the other partners in the room who are working these kinds of issues as well. Thank you.
Thank you, sir. Who are we yielding to?
We have representatives from the Family Support Center of South Sound and Family Justice Center.
Do you want, are they going to come and speak?
Yes.
Okay, then Natalie Scorvran and Trish Gregory. Is she Trish?
Yes. And
There we go.
also Safe Place and the Providence Sexual Assault Center.
Sarah
If
Lloyd?
everyone could please come up.
Sarah Lloyd from Safe Place, yeah, and Tina Olson, Sexual Assault Clinic. Please come on up. Thank you.
Good afternoon.
Good
Thank you
afternoon.
so much for having us here. I'm Trish Gregory, Executive Director of the Family Support Center of South Sound, and the Family Justice Center is one of our many programs that provide services for families with children and survivors of domestic violence, sexual assault, and human trafficking. So I'm going to defer to my colleagues to speak more about the programs and services that they offer, but I just want to echo what John Thunheim said, that these crimes against people are very significant in the lives of the women and the men that that they happen to, and acknowledging and ensuring that they don't happen is extremely important. So we're grateful to be here, and I'll defer to my colleagues. If you would like to.
I'm Natalie Scover, and I'm the Deputy Director, and like Trish said, we appreciate being here and being a part of a bigger system. It's a collaborative effort. It's the little work that our advocates do and our staff do, that our shelter staff do, any mix of our team, and we're part of the community that works alongside each other to make sure that a survivor, no matter when they're coming to us, how they're approaching us, where in that process they are, that they have choices, that they get to make a choice, and that we're there to provide the variety of services. So, thanks.
Thank you, Natalie.
Hi, I'm Tina Olson from the Sexual Assault Clinic and Child Maltreatment Center. We saw over 350 kids in our clinic last year, and it's just too many. It's not surprising, this number, because about 70% of the children, of reported sexual abuse is of 17-year-old and younger. Our hope is to reduce that number by increasing awareness and education in the community, by providing free trainings that equip adults with tools to prevent child abuse, identify warning signs, and react responsibly to potential abuse. We all have a role to play, and we're working hard on protecting others, especially children. With the leadership, such as yours, and the dedication from community organizations and individuals, we can successfully reduce the number of sexual assaults in our community. We can support survivors, and we can build a culture that doesn't tolerate sexual violence.
Thank you, Tina. Sarah.
Hi, my name is Simon Conrad. I'm
Simon.
the Sexual Assault Program Manager
Okay.
at Safe Place. Safe Place, we have quite a few programs where we work with sexual assault survivors. Something that I think is important to say too is that not all sexual assault has DV. As a matter of fact, very little does, but most DV does have sexual assault. So those two issues are often intertwined but not spoken about. One of the programs that we have is our SARP program, our Sexual Assault Response Program. We provide advocates to the hospital when clients come in to get what's called a sexual assault nurse examination. That's when they're having their body checked to make sure that they're healthy and safe, but then also to collect forensic evidence. So we go in and help clients through that process. Then we can work with that client afterwards and support them through the decisions that they're making. We have a shelter where we can bring in sexual assault survivors that need confidential shelter. We do that for trafficked individuals as well. We work fairly closely with law enforcement in order to bring in clients who do need that, that shelter. We do have a program called, oh man, that camera's freaking me out. We have a program where we go into high schools and junior highs, and we teach healthy relationship skills. That program has been very successful in starting that conversation early with individuals on how to have healthy relationships and how to be in healthy relationships. But I think one of the most important things is as a community, we need to make sure that we're supporting sexual assault survivors in the choices that they want to make. And what that looks like is not telling a survivor what they need, but listening to what they need. They have a healing path that they need to walk down, and as a community, we need to light that path for that individual.
Wonderful, thank you.
Thank you.
Questions or comments?
No, thank you all for what you do. Tough deal.
Questions or comments?
Tough job.
Thank you for being here.
I would just say what the work your organizations are doing, you personally and your organizations, and PHSS and the prosecutor's office, is most of the time not even seen by the public. And most people don't want to admit this exists. They can't accept or imagine, and they shouldn't imagine what it looks like. And doing, for 3 years in the late 80s as a child crimes investigator for Olympia PD, you see this stuff firsthand, and it stays with you forever. So what you're doing now, even more enlightened than we were back then, is very powerful, important work. So thank you very, very much for all that you do in your organizations. Now, the proclamation.
All right. Thurston County Proclamation, Sexual Assault Awareness Month. Whereas sexual assault is a broad term that includes a range of harassment, assault, trafficking, and other violent or unwanted sexual experiences. And whereas sexual violence is a widespread, serious, and preventable public health problem that affects millions of people each year, including children, teens, adults, and seniors in our community. And whereas in Thurston County, by their senior year in high school, 1 in 3 girls and 1 in 7 boys have been forced into unwanted sexual contact. And whereas on campus, 1 in 5 women and 1 in 7 men are sexually assaulted during their time in college. And whereas 1 in 5 women and 1 in 71 men will be raped during their lifetime. And whereas child sexual abuse prevention must be a priority to confront the reality that 1 in 6 boys and 1 in 4 girls will experience sexual assault before they turn 18. And whereas people of color and marginalized members of our community are significantly impacted by sexual violence, with nationally half of Native American women, half of African American women, half of transgender people, and a disproportionate number of LGBTQ people experiencing sexual violence in their lifetime. And whereas the goal of Sexual Assault Awareness Month is to raise public awareness about sexual violence and educate communities on how to prevent it through the I Ask Consent campaign, which champions the power of asking for consent, whether it be asking to hold someone's hand, asking permission to share personal information with others, or asking if a partner is interested in sex. And whereas our community promotes sexual violence prevention efforts and healing services for survivors of sexual assault by supporting community partners and organizations who do this work. And whereas consent is a clear, concrete example of what it takes to end sexual harassment, abuse, and assault. Now, therefore, be it resolved, the Board of Health hereby proclaims April as Sexual Assault Awareness Month in Thurston County and urges all citizens to put consent into practice. I ask is the statement by which individuals will demonstrate that asking for consent is a healthy, normal, and necessary part of everyday interactions. Adopted this 9th day of April, 2019, Thurston County Board of Health.
So, Natalie, Trish, Simon, and Tina, John, and Shelley, come on up for the presentation, please. I'm going to shove my way right smack in the middle somewhere. Oh, good. Thank you, Ty. Thank you. Did you get one, John? Shelley. There you go, Shelley. Thank you. Hey, Trish, is there someone in your office that would like an additional one? Here's an extra. Sure. Thank you. Thank you, John. Next proclamation is the Prescription Drug Take-Back Day, April 27th. And presenting, we have Chris Hawkins. Hello, Chris.
Good afternoon, Commissioners. My name is Chris Hawkins, Program Manager with Thurston County Public Health and Social Services, and I appreciate you taking the time today to recognize National Prescription Drug Take-Back Day. That is occurring later this month. We know that properly disposing of prescription drugs protects both the environment and our community's health. And raising awareness of this is a key part of a strategy to reduce the misuse of prescription drugs. We are helping to put together awareness raising around drug take-back because we have a number of coalitions, the board, our health department, partners in the community who are interested in helping with youth substance use in particular. Last year on National Drug Take-Back Day, Americans across the country participated and effectively disposed of 1 million pounds of potentially dangerous expired, unused, and unwanted prescription drugs at 6,000 sites. We're grateful that the board, our department, and partners are working on this effort and trying to bring greater attention to this issue. As you know, our county, like many others around the United States, are facing an opioid epidemic. Prescription drugs are part of that, and young people are especially at risk. The science tells us that a younger a person starts to use some kind of drug like a prescription drug, the higher the chances are that they will struggle with an addiction during their lifespan. According to the Healthy Youth Survey data that you've heard referenced already, 10% of Thurston County 10th graders report using prescription medications that were not prescribed to them. And in some parts of the county, that rate is even higher. Thurston County has 2 youth substance use prevention coalitions that our department is working with. They happen to have some representatives here today from the Tumwater Hopes Coalition. That's Healthy Opportunities for Prevention, Empowerment, and Success. Jennifer Simmons, who is a staff person with our department, has been facilitating the development of that coalition, which is new this year. With her are Charlie Schneider, Pastor Brad Morrill, Aaron Defoe, and Jay Mason, Commander Jay Mason from the community of Tumwater. We also have with us Terry Wimsett, who is our staff person who is supporting the Tenino, or the Bucota Tenino Healthy Action Team, or BVAT. And they're here today to stand in support with you of this important event and related efforts. So there are many reasons to support proper disposal. Reducing access to prescription drugs by reducing the need to store unused or expired drugs is an effective drug use prevention strategy, again, especially related to young people accessing those drugs. Proper disposal keeps prescription medication out of our groundwater and other waters in our community, and that obviously is a way to protect the environment, which contributes to a healthy community. And the disposal of expired and unexpired medication proper disposal also reduces the chances of accidental poisonings, particularly among seniors and, again, young children in our community. So how can people help with this? Well, our community benefits from people participating in the available services for proper, safe, and secure disposal. We happen to have 7 drop boxes around Thurston County. They are conveniently located in all the cities at police departments. This is a service provided by those police departments, and it was helped be started by our department, our hazardous and solid waste team within the health department. Got those boxes established. So in Olympia, those sites happen to be here at the Sheriff's Department, outside of Building 3, and Walgreens here on the west side of Olympia. And the other cities each have a drop box, and the hours can vary at those drop boxes. They are only open during business hours in the South County Police Department locations. Lacey and the Sheriff's Office are open 7 days a week, 24 hours a day to properly dispose of those unwanted or unused medications. So there is some available resource there for people to dispose of these things properly. And the best practice is to not store those medications at home when you don't need them anymore. Try to dispose of them properly, safe, securely, as soon as you can, is the appropriate way to proceed with that. And of course, if you are storing it because you still need those medications, then you should try to store them out of reach of people that shouldn't have them, particularly young people, and behind a locked cabinet door is the best way to do that. So proper drug disposal brings our county closer to its strategic plan goals. It helps with accomplishing the strategic goals of community partners like these coalitions in Tenino and Tumwater. And it helps our department achieve its mission of working together to achieve the highest level of health and well-being for everyone. And that goes for Thurston Thrives and its strategies as well, implementing environment and clinical care strategies around this topic. So I wanted to thank you for your time today in recognizing this National Take Back Day, as well as your support of substance use prevention in general and environmental health in our community. Thank you.
Any questions or comments?
You know, I just don't want to let you leave without being blunt with the public. And I'm going to say, just please don't flush. And the reason I say that is because I've talked to so many people out there that think they just don't pick up on the fact that flushing in a septic system is detrimental. It just doesn't seem to get in, and they tell me that, well, I flushed grandma's or whatever it was. But pharmaceuticals are one of our bigger challenges in our clean water, and it's showing up whether you've got an on-site septic system or you're on a sewer system. So I think if we come up with some kind of a deal, it grabs their attention or shocks them, I don't know what it is, but just, I mean, when you say, please don't flush, everybody kind of looks like, what? What are you talking about? Yeah, I really think it's worth pushing because it is so detrimental to our environment. So I'm just going to let it go with that. Thank you very much for all you do, Chris.
Thank you.
Appreciate it.
I wanted to point out that these bits of information about proper disposal of prescription and other drugs are available around the community at various public locations. So we put out these flyers that allow people to find where those drop boxes are. But again, they're at every police department around Thurston County, and in Olympia at the Sheriff's Department. And you can get more information about that from visiting the health department's website or finding these.
I guess I'm going to be a little blunt. Are you trying to tell me that there's not a drop box down at the Olympia Police Department?
Not currently.
Or City Hall? No.
Well, they must be working on it, I'm sure.
There will be eventually sometime downtown in the future.
Yeah.
There is a new statewide legislation that is going to increase the availability and convenience of these drop box locations for Thurston County residents. That will be implemented in probably within the next year or so.
I guess I'll do my best to be nice.
Well, I figure if Rainier has one, if they can afford one. Go ahead.
Chris, I just wanted to say that I might have been buried in the stats that you were giving, but a stat that I just recently heard, and sort of underscoring how important this is that it was a really high percentage, I want to say 58 or 60 or some percentage of all opioid addictions begin with access to like medication, expired medications that they have access to in the home.
I don't have that stat
okay. I didn't think I heard you say it, and I just want to say that because I heard that, and then I heard it right when I was hearing about this for the first time, and it was like, ding, 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 this is really important. So thanks for facilitating this, and hopefully we can get a big response from it.
One of my older brothers is 11 years older than I am, and we were chatting over the weekend. He lives in Tri-Cities, and he said, hey, we got this drug take-back thing coming up. Have you heard about it? I said, boy, have I. So the first thing I told him was, hold on, don't flush it. Whatever you got, don't flush it. He goes, well, I'm not on septic. And I said, I don't care. You're on sewer. The treatment plants aren't able to filter out pharmaceuticals, and they're finding them out in the drink, out in the sound.
Fish don't like it either.
Yeah, the fish don't like it, and I don't like to digest them when I eat fish. So we had a nice, great chat, and he's holding on to all this junk to get rid of it legally and safely. But also told him the pills in the coffee grounds, wet coffee grounds, because I heard that's still valid.
The preferred method is to take these
of
unwanted
course, yeah.
medications to
But you
a
drink
safe,
coffee every
secure
day. You drink
drop
coffee
box.
all the time.
Good answer, good answer.
Preferably not in your home garbage bin, outside your house, and
Yeah,
preferably not down the drain.
Oh, thank you, Chris. Now, is there a proclamation?
Yes, sir.
I
Thurston
think
County
there is.
Proclamation, Prescription Drug Take-Back Day. Whereas National Prescription Drug Take-Back Day is a day for every American in every community across the country to do their part to fight the opioid epidemic and help maintain a healthy environment by safely disposing of unwanted prescription medications from their homes. And whereas the Drug Enforcement Agency launched a national drug take-back initiative in 2010 with the Environmental Protection Agency and the Food and Drug Administration, because expired, unused, and unwanted medication can be a public health and public safety issue. And whereas disposing of unwanted or unused prescription medications safely, rather than throwing them away or flushing them down the toilet or drain, prevents them from getting in the water supply. And whereas disposing of unwanted or unused prescription medication regularly prevents them from finding their way into the wrong hands. And whereas Thurston County is facing an opioid epidemic that has a serious health impact on individuals, families, and the community, with safe medication return disposal options being a key prevention strategy. And whereas 5% of Thurston County middle school youth are abusing medication by using drugs not prescribed to them, and many teens think it is safe because the medication came from family, friends, or their own homes. And whereas helping people safely dispose of prescription drugs at no cost to local residents is one of many important ways our local law enforcement agencies are working to reduce the impact of prescription misuse, abuse, and overdoses. And whereas our county government promotes National Take-Back Days, along with our local jurisdictional partners, including the City of Tumwater, City of Tenino, and our Community Youth Substance Abuse Prevention Coalitions, Bucota Tenino Healthy Action Team, BTHAT, and Tumwater Hopes, Healthy Opportunities for Prevention, Empowerment, and Success. And whereas the Board of Health supports implementation of the new Washington state law that establishes a statewide system of regulation for safe and secure collection and disposal of medicines through a uniform drug take-back program, and encourages Thurston County residents to participate in safely disposing of unwanted or unused medication as a routine habit. Now, therefore, be it resolved, the Board of Health hereby proclaims April 27th as Prescription Drug Take-Back Day in Thurston County, and urges all residents to participate and dispose of unused, unwanted, or expired prescription medications at a local, safe disposal location. Adopted this 9th day of April, 2019, Thurston County Board of Health.
So we have the City of Tumwater and City of Tenino coming up. Where are my Tenino peeps?
Well, they couldn't come, so you just got me.
Oh, okay. No, not just, not just.
Hey, Jay, how many years you got in now? 26. Oh, geez. It just doesn't hardly say.
When did you make commander? Oh, beautiful, man. Beautiful. Good.
Good for you.
There you go, Jay. Chris? Not me again. Who doesn't have one? There you go.
Everyone ready?
Thank you. Take care.
See ya.
Thank you very, very much.
Thanks.
Again. Thank you, sir. Thank you. Thank you very much as well. Please do. Thank you. You're very welcome. Thank you.
Good job, Chris.
Kateri. What we're doing. Hey, take your meds. Oh, back. All right, now we're moving on to agenda 3 on the, agenda item number 3. Opportunity to address the public, or the public to address the Board of Health, rather. Has anybody signed up? Nope, okay, then we'll move right on to item number 4. Department items, homeless and public health crisis update. Keely Marino. Yay. Yay, Keely.
Good afternoon, Commissioners,
Good
Board of
afternoon.
Health. I'm pleased to come before you today to talk a little bit about what's been going on with regards to homeless response. And I chose 3 specific topics that are tangible and which really highlight mitigating harm in our efforts to address homelessness in our county. One of them is in your packet. One of them is an overview of the Code Blue response that we had this season. As many of you, as you may know or may not know, that the Hazardous Weather Task Force was started in September 2017. And in the first iteration of the Hazardous Weather Response Plan, we did have a Code Blue event in February of 2018. It's about 3 or 4 days long. Following that, in this cold weather season in 2018-2019, we had our first cold weather Code Blue response in December for 3 days. 1 month after I started in my position, we had what became a 12-day Code Blue event. This incident report that I have created for you kind of goes through what that looked like in terms of the timeline, what a Code Blue event is, who our partners are and who stepped forward, and then also kind of what happened. How many people did we see? How many extra beds did we have? And also then some feedback that we got from the Hazardous Weather Task Force around what we can do to improve the system next go around. Some of the more exciting, I would say, elements of this Code Blue is that with some centralized coordination, we were able to prolong or see a significant increase in those who attended the Salvation Army's extra beds that they had offered at the worship center. In 2018, in February, we had a Code Blue shelter, stand-up shelter at Interfaith Works down at First Christian. And this year they were not able to offer that same space. It was quite overwhelming. And at one point there were 117 people that were staying in that shelter during that first Code Blue. So Salvation Army generously offered to provide not only their downtown shelter, but then also their worship center on 4th Avenue. During the first Code Blue, not really well advertised because it's a new shelter, we had lower numbers for those folks that were staying in that extra shelter. But this go around, after the first day, we went up 26, 36, 46, 56, 66 extra people. All of the other beds that were available in Olympia were completely full to bursting. So an excellent use of that space. And part of that was made possible because we were able to partner for the first time with intercity transit. And they offered not only free rides to folks that wanted to access shelter during the Code Blue, but we also had use of their community vans. So partners in prevention education, the City of Olympia, myself and CYS, other folks offered to drive the vans to pick people up from locations in encampments downtown or in the community at large to take them to the extra beds at the Salvation Army Worship Center. On top of that, one of the things we noticed during Code Blue is that even though it was snowing, and even though it was snowing quite a lot and it was very cold, within the first couple nights it was clear that many, many people who were staying in the encampments unsheltered were unwilling to come into shelter. A lot of the reasons that they gave for that was they didn't want to leave their things. They didn't trust that this wasn't an effort to then sweep their camp. They thought they didn't want to leave their loved ones. They wanted to just remain with their community that they developed their sheltering in place. And so for the first time ever, as an effort to mitigate harm for those out in the woods and to basically keep them alive, Thurston County, through the Hazardous Weather Task Force and those dollars, Code Blue extra dollars, we were able to purchase survival supplies and go out to those encampments. City of Olympia staff came out, Partners in Prevention, other partners, provider partners came with the vans to hand out socks and hand warmers and water, whatever it was that they needed and that we could provide in order for them to stay safe in place. So it was a really amazing effort. This is, of course, back in February, and luckily we haven't had to declare another Code Blue. But with the efforts that this entire community and the Hazardous Weather Task Force, like the way that we all came together, we are well set up for the seasonal weather that is coming. In fact, we're already planning for the smoke season. There's already been a number of forest fires west of the Cascades in March. There were 48 of which were in west of the Cascades already. So we're looking at a potentially really hazardous fire season come the end of August, the beginning of September. So we're already making efforts to, one, secure supplies now, so we're ready to address it, find secure storage so that we can have it equal or accessible in centralized location, and then to prepare in advance for what it's going to take to get folks through that time safely. So we're in the beginning stages of that. And then we intend to have a really robust volunteer training and get a staff corps ready to go for a sheltering event that we might have to repeat this kind of effort come this upcoming cold weather season. Another thing to keep in mind is that the shelters are still running at full capacity for cold weather, and that cold weather season is ending on April 31st or 30th. Come May 1st, there's upwards of 100 or so people who will no longer be able to access those cold weather beds because those are beds that are set aside specifically to get through the cold season. So just something that I'm keeping in mind and planning with our partners, what do we do? And how do we anticipate a number of people being on the streets that aren't on the streets currently? So that's the Cold Blue and how that went. And if you have any questions about the report, I'm happy to answer them.
I do. Do you have any?
Nope, I don't.
Go ahead, I'm still checking.
My question is, Keely, did we deplete our supplies for winter?
Yes.
They're depleted?
We have some blankets left. And so those blankets are being stored for our next sheltering in place, or if there's a shelter that has run low, then we can provide those blankets to them.
So we're restocking not only for next winter, but we're restocking for the next season?
Yes, that's what we hope to do and intend to do.
Okay.
Yeah.
And then my final question is, we have storage we're using somewhere now, and is it just one unit or is it spread out?
Right now it's spread out. It's the grace of Partners in Prevention Education and Interfaith Works at First Christian. They're storing some of the blankets, and then Partners in Prevention have been storing in their little purple house, they call it, downtown, some of the supplies.
Would it be beneficial to have one central located
Absolutely.
location?
Yes, and we're talking with Salvation Army about the possibility of utilizing their lot down on State Avenue that's currently unused.
Okay.
Yeah.
Thank you.
Keely, how close did we get to, it sounds like that this is somewhat flexible in terms of, hey, there's a bigger need, and you reached out and you got extra space at the, like you said, the worship center that hadn't been accessed like in previous year.
Yeah.
So I guess how close did it get to a crisis of capacity in terms of people that wanted to come in and wouldn't have to be turned away?
We were at capacity for all of the shelters that we have downtown. Salvation Army also is their downtown shelter is also in a process of doing some reconstruction, and so they had limited number of beds. So it's a little bit of a misrepresentation because their normal beds weren't available due to the construction, but they extended their cold weather to go up to about 60 during those colder nights. So pretty representative of what would have been there if they had their regular shelter. But with that, we were at capacity. 66 was a push at that warming center, for sure. And at that time, we still had the Smart Lot downtown. So the Smart Lot was the unmanaged camp that was moved or swept at the beginning of March or in the middle of February. And so that was heavily occupied at the time. There was a lot of sheltering in place activities that happened down there as well. And so I would argue that we'd need even more capacity next year if people are still unsheltered.
Okay.
Okay, anything, Green?
No.
Okay,
Thank you.
go ahead. Any more?
Yeah, so we are working on, really adamantly working on the 5-year plan. And all of the conversations that we've had with all the groups that I've convened with for listening sessions and then work sessions with our partners for the core team have been really focused on how do we write this in a way that's easy, that's accessible for folks to, anyone to pick up and understand what it is that we're doing as a county. What are the guidelines from the state? The state has just issued newer guidelines as of March, the middle of March, 2019. And so we've had to kind of adjust again in how we address their guidelines for a 5-year plan, which of course the current one was already approved in June 2018. So we're rewriting that one. And a lot of the guidelines are around identifying and engaging, prioritizing people for housing projects based on needs, so that vulnerability question again. Coming up with effective strategies as a crisis response system to expedite people into housing efficiently. And then a projection of kind of a guess. They want us to make a guess for 2024. How many people do we anticipate being housed? How many will still be unsheltered? And then they've just added for the first time a piece where we have to, as a county, account for our disparity in terms of racial disproportionality in our homeless population. So we are mandated by the state to, as a county, directly address how we are going to address the disproportionality that we see in our homeless population. So a lot of interesting and innovative conversations that are coming forward with our community and how do we write this plan in a way that meets the guidelines but actually has added value to our community and can be implemented. And it isn't just pie. It's pie in the sky, but it's not just pie in the sky, if that makes sense. So that's where we're standing with the 5-year plan, which is completely connected to and coinciding with looking at our coordinated entry system. If you notice, the first 2 guidelines that the state has put forward require us to have a robust and very functional coordinated entry system. And so we've been convening to discuss how do we address the single adult population and the expanse of services to families and youth in both Tumwater and Lacey, when our coordinated entry so far has been pretty centric to, it's kind of an in-reach program for youth, families, as well as single adults, be it at Family Support Center, Community Youth Services, and down at Community Care Center. So how do we innovatively reach communities that we're not reaching right now? How do we extend the reach of, especially into the single adult population? And so we've been making plans for how to turn coordinated entry into an outreach-focused activity rather than focusing only on in-reach. So all of it is kind of coinciding beautifully to make my life a little bit easier to address all of these issues from guidelines coming down from the state, and then also to hopefully create a plan that really is meaningful and makes a difference.
How is the process for like updating our 5-year plan? Is it, I think I've heard that there's some different folks that are being involved. I mean,
Yes.
Could you describe how we're changing our approach to making those revisions?
Absolutely. So I've been convening with some of the subpopulation groups. So that we did last time as well. So youth and young adults, families, and single adults, which I'm kind of combining with the coordinated entry. But we've also convened a jurisdictional conversation, which is really exciting because as of February 7th, Tumwater put forth a plan that they've been talking about around affordable housing. Lacey has a plan around affordable housing. And then Olympia's got their homeless response plan. So I said, let's get all the plans together and let's see how they coincide or don't. And so we had a really great conversation, and we're meeting again this month to pull out all of the policies that each jurisdiction has, put them on white paper, put little dots around them, make sure that if we have overlays, that's great, but where do we have the gaps in our system as a county? And then I'm hoping to convene with law enforcement entities as well. I know that that's a really crucial part of addressing homelessness in any community. So getting kind of an idea of where each jurisdiction stands on their own response, specific to, Lacey, Tumwater, Olympia, and then the county in general. And then I've been kind of piggybacking on the homeless response plan with Olympia because in the guidelines it states clearly you can basically piggyback on other efforts going on in a community to rewrite the guidelines. So that's what's going on so far. We'll have a public comment period in July and August, and we're hoping to have a draft ready for you all to look at in August.
Good question, because I was going to ask about the collaboration in your networking with your cohorts and peers up here in the north. And knowing that the South counties don't have designated housing or homeless staff, how do we reach out or talk with them?
That's a really good question. I'm hoping to reach out to, I know that Yelm has a homeless task force. I believe it meets on Tuesdays. I've been meaning to get to that meeting. I haven't gotten to that one yet. Reaching out to Rochester because they do have a program there with Roof.
Yeah.
And so, and I've been talking with some colleagues at the Public Health and Social Services that are already in those communities. And I'm going to be going with them when they do some presentations to kind of connect myself to the people that I need to talk to around what it is that they're needing or expecting.
Anything regarding Rainier, Tenino, Bicota?
Yeah, yes. So Roof, I'll reach out to Roof,
Okay.
and then Be That, and then Elisa
Okay, be that.
Sparkman, I believe, at Public Health and Social Services, who's been doing the rental, working with
Okay.
landlords. So I'll be going with her.
Beautiful.
Yeah.
Anything? Anything further? Good, thank you.
All right. Thank you so much.
Thanks, Keely. Agenda item number 5, Thurston County Medical Reserve Corps update. Jennifer Dixon. Education Outreach Program Assistant.
Hello.
Hello.
Thanks for having us.
Yep.
I brought some of our medical reserve corps today, so I'm just going to give you a quick introduction and then let them take over.
Okay.
But as you guys know, our medical reserve corps is a community-based volunteer program that strengthens and expands our public health system's response efforts during a health emergency. Our Thurston County Medical Reserve Corps was established in 2003, and currently we have about 90 active volunteer members. And they do community events. We do those all throughout the year, but we've also had unique opportunities to do some deployments recently. And all of those things combined help train our volunteers as well as some staff to use those as ways to help our own community in the event of an emergency or disaster. So we're going to talk about the community events, and I have Dr. Randy Moeller and Courtney Moeller, who's a registered nurse, to chat a little bit about that.
Good afternoon. My name is Randy Moeller. I'm a retired family physician from Group Health, now Kaiser, and this is my partner in crime for the last 42 years. Curdy. So we have worked for the MRC for the last 2 years, and as I look at the list of community events, we've participated in virtually all of them with the exception of the Washington State Senior Games. So I first participated in the Seattle to Portland aid station when I finally stopped doing the actual ride myself. We've done back-to-school immunization clinics, hepatitis A immunization clinics, and flu shot clinics, which is a little unusual for a physician. Typically in my clinical world, I would let a nurse know that the shots were needed and move on to the next patient. And it's a little more personal now. I have to do informed consent and actually work with the nurses to make the shot palatable to a population that often is resisting the whole notion of it. And it's been very rewarding to use the skills that we have and make it actually work. So we've been very pleased with our ability to participate in that program. That if it were not on a volunteer basis would be difficult to pay for all the outreach that we have done. Yeah. As to why we do it, I would say I had a connection to the public health when I was actually working. A very good friend of mine and coworker, Britt Smith, got involved years ago, and when we retired, it was a natural that if I didn't want to be on the treadmill of providing continuity to patients on a regular basis, which in retirement I didn't want to do, this was a great niche for both my wife and I to participate, use our experience and our skills to provide care that's needed in the county.
Wow, very good.
So what I've done is I take orders.
Get right to the microphone. Get right to the microphone.
What?
Get right to the microphone. Thank you.
What I do is I take orders from the doctor, and my first job is to see how many of those orders I think are wrong, and then I go back and say, you do not need 6 shots, you only need 4 shots, and I always get a smile out of the kids. When I first signed up for the MRC and I went to my first immunization orientation, there were about 6 of us, and none of us had given shots to children in the last 20 years. Well, I can't say that anymore because I have worked hours now giving immunizations, some children up to 6 shots at a time, at the back to school one. And that's been it's been so fun and so rewarding, and I won't say easy all the time, but it's interesting. And then we went and worked in one of the homeless shelters giving hepatitis A shots, and that was also a highlight of our summer. So those are the things we do.
Then we have Theresa, Garrett Hill. She's also a registered nurse, has done a lot of our community events, but then she's going to talk a little bit too about going to North Carolina on deployment to help with hurricane recovery.
Good afternoon. Thank you for this opportunity to share my experiences. So I'm a recent newbie to MRC. I joined in May, this past May. I'm a new transplant from King County, South King County. So I'm learning about my community, and that was really kind of my interest in learning to volunteer here and connecting with the community and resources. My background is mostly in community public health, working with vulnerable populations, those who are experiencing the health disparities. So I obviously have had a chance to do some of the immunization clinics as well. But then I also had a chance to respond to the call up for nurses and mental health professionals last fall in September for Hurricane Florence with a partnership with the Red Cross. So that was a unique opportunity as well for the MRC to participate in. I was stationed in Wallace, North Carolina. We had about 45 clients in our shelter. I learned a lot about the Red Cross, so it was extremely valuable in learning about their organization, how they shelter and conduct their health services, and I think that's a great value partnership with MRC, and it's sort of giving me ideas to think about, my work here with MRC and the community. And that's it. Any questions? Or?
So you just moved, how long did you move from King County here?
It's been 3 years, yeah.
Welcome to the light side.
What's that?
Welcome to the bright and light side.
Yeah. Thank you. Yeah. No, I've enjoyed it, and this has been a great opportunity to connect with people in the community, the partners that we have, as well as the individuals who volunteer and the staff. So it's been a great experience.
Wonderful. Thank you.
Yeah, thank you.
Okay, and then last we have Dr. Britt Smith. He also went to North Carolina, deployed there, but he was lucky enough to go down to Clark County and help with them with their measles response as well.
Oh my gosh, yeah.
So I'm Dr. Britt Smith. I grew up in this community, and that's one of the reasons I volunteer, is to give back to the community that gave me so much. But it's very valuable in my mind to have lay populations as well as professional populations trained to respond to a disaster or event of some sort, and we will have ours sooner or later. And so it's helpful to have been part of the surge response at another location. Those 2 locations for me were down in North Carolina after the Florence hurricane to do relief work with the Red Cross, which invited the MRC to provide people to come down there. And the second one was to go down to Clark County to respond in a surge capacity for their measles epidemic, which is still ongoing, and which is one of the reasons that we have so many shot clinics every year to get the children vaccinated before they go back to school. If we can get up to 95% with our vaccines, we have herd immunity. If we don't have that much, then unfortunately, even the populations that have been vaccinated are at risk for acquiring either measles or pertussis, which are 2 epidemics which are ongoing in this state and this county. Both of those exercises demonstrate what it means to be the surge person. They use the incident command system, which allows us to have columns of people that you respond to. So I have a boss, and my boss has a boss, and they can just plug my body into somebody else's job with just-in-time training, so I know what I'm supposed to be doing in that environment. And that's what we would do in this community as well. Do you have any questions about that?
Any questions?
I don't really know enough to ask questions on this topic, to be honest with you. I do want to say something, though. Are we about winding up here?
Well, I don't know if we're winding up, but go ahead.
I just think that we are so fortunate to have people like you folks involved in our community making a difference. It's just unbelievable the commitment you must have, and I just can't say enough. Thank you very much for all you do.
Thank you, sir.
Yeah, we're not winding up yet. Do you have any questions or comments?
I just want to echo that. As a new commissioner, you learn about a million things and a million different groups in the community that do things. And I'd say you guys are like top of the list of just things that I didn't know about that I'm just like, wow, there's people putting that kind of time into that kind of work. It was a really, yeah, it's great to see what you guys do.
And you're probably not, you're not trained, you are now, but I mean in the ICS, Incident Command?
Yes, sir.
You are now, but were you before, in your previous life?
I've been doing this with the MRC for 15 years.
Okay. That ICS is great training and a great logistical framework to work within. And I think it's nothing more honorable than providing service to other people. So thank you very much for what you do.
Are we going to get a photo with these folks?
Okay, then. Yeah. We have someone with the
I mean,
camera?
can we?
Oh, yeah. Yes.
This is like so cool.
Good idea.
I just think this is great. You folks are willing to give your time. What a deal. Thank you. Thank you so much. Thank you.
Item number 6, Surface Water Program Update, Environmental Health Division Director, Art Starry.
I will make a very brief appointment. Do your performance and turn over to Jane. So good afternoon. I'm Art Starry, the Environmental Health Director and for Thurston County Public Health and Social Services. And here today is Jane Montrevenning, who actually is the supervisor for the program that does the surface water monitoring in Thurston County and deals with things like beaches and shellfish biotoxin and all that. So here to talk about that and the program and the services that we provide is Jane Montrevenning.
Welcome, Jane. Welcome.
Good afternoon.
Hi.
This is a little bit of switch from everything you've been hearing so far today. So we're moving over to environmental health, which folks tend to think of means a healthy environment, which it does, but it's really about human health and how the environment affects that. So we do have a slideshow, which we're too far ahead. Go back one. Go back to.
You have the control.
Oh, I have the controller? How do I work it? Well, that's pretty straightforward. There, okay. You'd think I know these things, wouldn't you? So we're talking today about our water quality monitoring program. And we do monitor, we want to find out how clean the water is, and how clean the water should be kind of depends on how you want to use it. So do you want to use it for making sure the stream can support a healthy population of fish so you could go fishing, maybe take the grandkids out? Do you want to harvest shellfish from our local beaches? Are you a shellfish professional and you want to earn a good income and support workers by harvesting shellfish? Do you want to drink the water? Do you want to go swimming or go recreating in the water? So all those different kinds of activities depend upon clean water, and how we go about monitoring to make sure that they're clean varies. So our purposes for clean water monitoring, or for water quality monitoring, is we want to be able to identify any problems and then therefore be able to accurately advise the public about what to do if we find some problems. We want to be able to track trends over time to see, is the water quality, again, is it meeting standards? Is it getting better, getting worse, kind of what's happening? And then we use that data, that information, to be able to prioritize what we do to correct any pollution problems that we find, and to pinpoint it and to really put our efforts where it's going to make the most difference. So again, we have a wide variety of water quality monitoring programs, each designed to answer different questions. I'll go over these types that I pulled out a little more in depth as we go along. But the different types of monitoring require different methods of going about doing the monitoring and answering the questions. So our baseline and our kind of the bones of the program is what we call ambient monitoring. So this is long-term monitoring. In streams, we have about 36 sites on 28 streams across the county. We monitor 10 different lakes across the county. The streams is every month, generally towards the mouth of the stream, so you capture all of the water that's coming down the whole system. And long term, in some cases, we've been monitoring sites for about 30 years. So this gives us good information about trends and, again, early warnings about problems that might be arising. I kind of think of it as almost like going to the doctor and getting your blood pressure checked regularly. You want to kind of just keep that feel, keep paying attention. So again, this is just a map. We have sites all over the county and all the major watersheds. We have staff out there actually today. We might see them tromping through on the way to the lab at the end of their day. So how's the water doing? In our streams, again, we collect a lot of data. We collect about 8 different water quality parameters for streams, about 9 or 10 for lakes. We take all that data, we crunch it. There's something called the Water Quality Index, which is a simplified way of taking all that information and kind of giving it a score and a quick look at overall how are we doing. And overall, we're doing pretty well. About half our streams fall into the low concern category, the other half into the moderate concern. We do have 2 streams, Reichel and the downstream station at Woodard Creek, that are really right on the edge. One more point and they'd be off into the high risk category. We're currently crunching the numbers from last year's water quality report, so or data, so we'll be coming up with that report the next month or so. The water quality index that is shown here is one part of the picture. When you delve deeper into the data, you also find more nuance. And so one of the things that we do see is that while we do really well overall in the water quality index, we do have very few of our streams are meeting the recommendations for nutrients, for nitrogen and for phosphorus. Most of our streams are quite high in those 2 parameters. And phosphorus is one that can lead to algae blooms in lakes, and that's another one of our monitoring programs is a response to toxic or to algae blooms to see if they're toxic or not. The same algae can be just kind of green and slimy, or it can turn and become toxic and be a health risk. So this is one that we do rely on citizen volunteers, residents, and other folks who use the lakes to give us a call when they notice an algae bloom. We also have volunteers on lakes who contact us, again, typically in the summer season, routinely to say, looks clear, there is no algae bloom, because that's important to know too. Sometimes you don't have information, but it doesn't mean there's no algae bloom. So again, when warranted, we would then go and post a lake and let folks know that there was toxic algae present and they should take appropriate actions. We also maintain an algae alert system via email and send notices out to folks where we take samples when we get the results back, and then if we do, issue an advisory. Another type of monitoring we do is swimming beach monitoring. And this, thank you very much, we were not able to do last year because we didn't have funding, and you provided some general funds for this year, so that's good. And we're going to be monitoring at 3 different county parks, Burfoot Park and Fry Cove Park through some state funding, and then Kennydale County Park through the general fund funding. And this will be weekly sampling close to shore at where the people are, swimming or playing in the water. And that's looking at bacteria and making sure that it's meeting standards and is clean enough to swim in and play in.
Jane, you said that's weekly. For how long? What duration?
Pardon?
What duration will that testing go on?
So that goes on from usually about Memorial Day and through Labor Day.
Labor,
In some cases, when we have the funds, because around here, our September can be pretty good swim weather, we like to be able to continue it through the month of
Okay.
September. Sometimes we're unable
Thank
to.
you.
Yeah. Another project that we do in cooperation with the state and other partners is biotoxin monitoring of shellfish. So this is, if you want to go out and dig shellfish on our beaches, we very much encourage you to check on the Department of Health's website for the shellfish safety map, or to call the biotoxin hotline to make sure that there's no PSP or various biotoxins that might be affecting the shellfish and making them unsafe to eat. So we collect samples up at Boston Harbor Marina, and Washington Department of Health and the tribes collect samples in other areas around the South Sound. So the other kind of big category of monitoring that we do is investigative monitoring. So this would be responding to things that come up. So pollution complaints, maybe there's been a spill and we need to see if whatever has spilled has gotten into the water at levels high enough to be of concern. If we have some reason to be concerned that we might need a health alert to, again, get the data so we can provide accurate information. And then special investigations, and we're doing more of this kind of pollution identification and correction work. We actually just received word that we'll be getting a large grant to do that in our shellfish growing areas. So we're looking at areas right now, the ones we have going on are in Dobbs and Fleming Creek, where there's been some high bacteria levels feeding into the Henderson Inlet and affecting shellfish growing there. There was norovirus outbreak associated with some shellfish in a small area in Eld Inlet that was quite concerning, because Eld Inlet has been very clean, but has been showing declining water quality. So that's the trends again. And so we're doing some investigative work up around that area. And then the Scatter Creek Aquifer is a drinking water source for a portion of the South County and the Rochester area, that we do regular monitoring down there to make sure that the drinking water will be fine. And again, why do we do the monitoring? Because we want to protect public health, making sure that the water that we like to use for fishing, drinking, swimming, playing in the water, eating shellfish is safe and able to be used, and will be a positive impact on our health and not a negative one. Each year we do publish a water quality report, and that is posted on our website. The latest one is from 2016-17 water year. We're actively working on crunching the data from 2018, and that should be available pretty soon. So you can delve into much more detail if you wish there, and I'd be happy to answer any questions now or later.
Do you do any well water monitoring?
We do in the Scatter Creek Aquifer as a kind of a special project. Drinking water purveyors, so either Group B systems or Group A systems, so people who, the groups that provide drinking water to larger groups of individuals are required to do water quality monitoring of their wells. We have at times done wellhead protection area monitoring in cooperation with the cities, but at this point they now have the capacity to do that themselves. So we offer we're support as needed. And then again, when we've had special projects, we've done that kind of monitoring, but except for Scatter Creek, right now we're not doing that.
Do you have a legend that goes like with this one map of the county with all the little pin marks on it?
Well, no, but I can tell you about it.
would show, I mean, like, is the red a problem, or?
No, the colors just have to do with what watershed it's in. So I can go back to that one.
No, I don't know if you need to get, I'd like to kind of see where you're monitoring and, what kind of, at some future date, not today.
Okay.
To see what kind of a history is developing or something, if there's a deteriorating of water quality over, a certain period of time, or over the last 10, 20, 30 years, if we've got that, so that we can compare that. And I'm on Dobbs Creek, is that one picture with the cattle standing in the creek or something? Is that a common activity up there?
That's not Dobbs Creek, that's a different creek in the, I think that might even be.
Oh, that wasn't Dobbs Creek?
No.
Okay.
It's just
You
an
have a-
example of some of the.
You have a briefing coming up on
Some
this, commissioners, later this month, where you'll get to dive into more details, and learn about this and ask more questions. And it'll
Thank
be
you.
available for the public as well.
Yeah, and a lot more of the details about this actual sites are in the report, so you could look there and find out exactly where we go.
Thank you.
Any questions or comments?
Well, if Shelley says we're having a deeper briefing, I have a lot of questions, but I guess because I have this report, and I guess the moderate concern or low concern or high, the water quality index, I'm not sure what goes into that or how that's formulated. I mean, and as you say, the categories are broken out in the report.
Right.
You know, so temperatures, for example, exceeding standard at half the sites designated as salmon spawning, rearing, and migration habitat. Dissolved oxygen, 1/3 of the sites designated as salmon spawning, rearing, and migration habitat had concentrations too low to support that. Same with fecal coliform, 46% of the sites failed to meet. I mean, that's high concern to me. So I would want to dive deeper into what policies we could look at to try to improve that. The one thing this report doesn't do is kind of a snapshot in time, and I agree with Commissioner Edwards. I'd like to know, is this kind of where it's been for the last 10, 15 years, or are we going down? If we're going down, then we have to take stock of what we're doing. And if it's steady state, then then that's maybe another course of action. But hopefully we can get deeper into this. I'm glad you guys are doing the work you're doing. And this report was, I saw it last summer when it was released last August.
Right.
And it was really good stuff in terms of breaking it down, where you're monitoring, what you're monitoring, all the different categories. Water quality is not one thing, as people. It's like five different things. Probably more than five, but for somebody at my level of expertise, which is it's basically pH level and fecal coliform, nitrogen, as you mentioned, phosphorus, dissolved oxygen, and temperature. And temperature plays a huge role in salmon issues. So I hope we can sort of drill down, look at these subcategories, and forge a path that will helpfully, I don't want to just level out. I want our water to be, I want 95% of our surface waters to be clean and healthy for kids and for fish. That's my goal. So
it's a good goal.
I want to beat you. I want 100%.
That's good too.
So, set the bar high and see where we go. But I am kind of concerned about some of those levels and what they mean, I guess. I mean, on the one chart here, we don't have anything over there on water quality index, high concern. Well, I mean, I think up on Dobbs Creek or something, we might have a high concern, and I don't know why. I hear about that quite often. So I don't know. I guess I'm just going to withhold my questions and wait until we have a more in-depth briefing. And I guess you are testing up around the Deschutes Park now?
We have entered a new, starting the last couple of months, we've added a new monitoring station up at Deschutes Falls Park. So we are starting to get data in the upper Deschutes.
I guess one of the things I'm obviously worried about is I've talked about this commercial application of chemicals for forest, use for growing trees, I guess. And I know they put it on in the fall and winter, and so I hope that you're testing during those periods, not.
Yeah, we've started, so that's part of one of our ambient sites where we test every month, year-round. So again, we've just added it the last couple of months, and we'll be continuing to monitor that site monthly, including for nitrogen, which is the concern from the fertilizers.
So we're getting a nice baseline. Thanks for turning that off again. Go on. So we're getting a good baseline
not
data
not
now?
necessarily a baseline, but the current status,
Right.
month by month.
Okay. There's I'm waiting for the briefing. It'll be a very good briefing, I'm sure. But there's a lot of good that's going on too. And we have some really good sites with water. And what I want to add is, excuse me, is I'm glad that we found money to start monitoring the swimming beaches for the kids and the families.
Yeah, that's a really important one
Yeah.
because they get heavy usage, especially in the hot weather, and we don't want to inadvertently, sicken a
Don't
lot
wanna
of
miss
people
anything.
because the bacteria
Nope.
level's high and we
No.
didn't tell them. Yeah.
Maybe just one other thing. I see Summit Lake doesn't have one of those little pins on it. And we're kind of paying attention to
Summit Lake is the map that you see is just the stream sites. It didn't combine all of them, but we do monitor Summit Lake for the ambient. So we don't monitor it looking at drinking water quality or swimming beach quality. We monitor it for long-term trends, including things like phosphorus levels and nitrogen levels. Well, yeah, phosphorus and nitrogen and temperature, dissolved oxygen, things like that.
Are we leaving that up to the citizens that live up there to make sure their water is treated, that they might get out of the lake? Is that our philosophy as a county?
That's a tough one. A lake is a vulnerable drinking water source.
Yeah.
So we've had an advisory on it for many years that it's not an ideal drinking water source, and that we recommend that people, consider carefully how they want to.
Do you know how many
handle that.
people up there get water out of the lake? Is it half or three-quarters?
I don't know.
More like the 3/4.
Yeah, it's a good high percentage of them. So there's not a lot of groundwater in the area, so there's not a lot of good alternatives. Locally, you might have to.
I guess we'll get an in-depth report.
Any more?
No, I got a lot more, but I'm going to wait for the next briefing.
Jane, thank you very much. Art, thank you. Is that it? All right, thank you, Jane. Now we're moving into agenda item number 7, Board of Health members, health-related activities. Yeah, what's health-related activity you want to report on?
I guess I'll say I spent quite a bit of time over at the hospital on the west side over at Capitol, and I guess I'll give them a compliment. This is a good spot to give it from the Board of Health. A lot of concerned professional staff over there, and I was around there for most of the week, and by golly, those people are dedicated and did a good job. I don't want to single anybody out because then you leave somebody out. But so, from my health hat, if you will, having had an opportunity to spend time.
Hopefully going to set the stage for some additional resources to our community for all sorts of really important health related work. The second thing is I sit for the board on the Thurston Thrives Coordinating Council, and
at a personal level with my wife, so they did a good job. So
Good.
It was kind of fun to see them hustling all the time.
Yeah, well, it's a loved one, yeah.
Yeah.
Hi, Darling.
That happened at our last meeting I thought would be of general interest. One is that the Thurston County Community Health Assessment, and correct me, Shelley, if I get any of this wrong, because you know better than I do, but the Community Health Assessment happens every 5 years, and it's about to be updated. And I got to attend a governor's bill signing for the first time based on a foundational public health bill, that 1497, and it is Thurston Thrives wanted to be play an active role in helping shape the scoping, priorities, and plans for that health assessment, and it was pretty much unanimous that we did. So Thurston Thrives will hopefully be able to give, which will give a broad base of input into that process. So that's good. And then the third thing was, and this I think I will defer to Shelley, but there was some exciting news about a grant through Kaiser Permanente toward Thurston Thrives.
Yes.
That'll help fund our staffing and kind of give a bit better structure to the organization.
Yes.
Could you expand on that?
Is that in your report coming up?
Just a little bit briefly, yes. The Kaiser Foundation did award a grant to Thurston Thrives to help advance our efforts on improving our community health and focusing on the social determinants of health, and also is giving Thurston Thrives the opportunity to participate in their community health needs assessment as well. So very exciting news and great work for the council and the whole community.
That's it for me. Thanks.
Good. And I only have one, and because I failed. Last Wednesday, I got a severe laryngitis, and the kind of the ironic part is my wife was out of town for the week. She was out of state for the week, so she missed out on almost 4 days of complete silence at home. I got my voice back Saturday or Sunday, and she returned Sunday. Ha ha. And that's it. I'm just hoarse. I'm fine. The doc said I'm not contagious. I just sound like dumb. Anyway, that's it. So now we turn to the health officer's report. You're going to report for Dr. Wood.
Yes, Dr. Wood is, I'm sure, very sorry that she missed that, Commissioner Hutchings. So yes, Dr. Wood is on annual leave, and so I'm just going to share a little bit of information from her and our communicable disease team and other team members at Public Health and Social Services. So in the last month, we have investigated and followed up on 100 confirmed and suspected cases of foodborne illness, chlamydia, gonorrhea, hepatitis B and C, herpes, influenza, suspect measles. Thurston County does not have any measles cases. Mumps, pertussis, salmonella, E. coli, syphilis, tuberculosis, and the flu. Many of these diseases can be prevented through things like hand washing, immunization, safe sex practices. So we encourage people to take care of their own health to prevent these illnesses. Speaking of the flu, as you may have seen in media reports, the flu continues later than usual this season. So cases of influenza A have been reported through our hospital surveillance system in Thurston County, elevated with 30% of tests positive for influenza. Influenza-like illness reports are well above the baseline for what we would expect at this time of year. There have been, unfortunately, 114 flu deaths in Washington State, with 6 of those in Thurston County, all in individuals over the age of 65. There's a concern that this activity is increasing across the country, and it does tend to be more severe in the older populations. So again, vaccinate against the flu, protect yourself, hand washing, stay home when you're feeling ill. Again, measles cases, we do not have any suspect cases in Thurston County currently, but as you may have also seen in the media, we continue throughout our country to be very concerned about rising measles cases. Clark County, at my last check, had 73 confirmed cases. And we are very happy that we had our Medical Reserve Corps team here today that were able to respond to that, to the Clark County outbreak, along with our public health emergency preparedness staff. So measles starts with fever, runny nose, cough, red eyes, and sore throat, followed by a rash that spreads over the body. It's highly contagious and spreads through coughing and sneezing. And again, best way to prevent measles is through vaccination. The syringe services staff have collected 369,629 syringes for disposal this year in 2019 through March 29th. 20% of those syringes were collected for disposal only, meaning the program is taking in more syringes than we distribute. So we're keeping syringes off the streets. Our staff at our syringe services also dispensed 696 doses of naloxone to date, which represents lives saved. And that is my report for Dr. Wood.
That's great. Before you move on to your report, I want to thank all the people that have been throwing throat lozenges, Jeannie Knight, just back staff, and I brought in my own supply. If anybody needs something, let me know. Now you can do your report now.
Yes. So I just want to take this opportunity again to thank all of our amazing staff and volunteers that came today and presented, and also acknowledge that last week the Board of County Commissioners proclaimed it Public Health Awareness Week. And I really just want to recognize and honor all of our staff for the amazing, amazing work they do to do things that you heard about today, like ensuring we have clean water to recreate in, to drink, to make sure that infants have vaccines and kids' health is promoted, that we're prepared for disasters and emergencies, and that people have shelter and housing. So I want to, again, extend my thanks to all of our public health staff, and it's really because of these efforts and because of all of our community partners that I have very exciting news to share that Thurston County has moved up in our national county health rankings to be number 5. That means we are the 5th healthiest county in the state of Washington. Just 5 years ago, Thurston County ranked number 9, and last year we were 6th healthiest. So we have moved up in the rankings. The national county health rankings are done by the University of Wisconsin and the Robert Wood Johnson Foundation, and they produce these every year. And it's really a way to provide an easy-to-use snapshot that compares counties within our states and shows that where you live influences how well and how long you live. And we're very fortunate that Thurston County is such a healthy place to live, work, and play. So we are very proud of that. I think it is because this Board of Health has focused on investing in social determinants of health, and we are paying attention to the inequities in our community and working together to address those to ensure everybody has the opportunity for health. We scored very well in several areas, including our high school graduation rates, lower rates of violent crime, and access to health care, such as those with health care coverage. But we have some serious improvements to make when it comes to focusing on reducing substance abuse, supporting physical activity, and improving nutrition, which could lower our obesity rates, and living in a healthy environment. And that means improving our air quality as well as our housing. So we're, again, very proud of that. We continue to work to improve the health of this community, and thank everyone for that. And also, how long we live is related to the efforts of public health and the investments in foundational public health. And Commissioner Menzer alluded to the great news that we had last week as well with Governor Inslee signing in House Bill 1497 into law. That's foundational public health. And you'll recall at your last Board of Health meeting, that was your first resolution of the year, is asking the legislature to support this bill. So it's because of your efforts and all of our public health advocates in our community that have been working for many, many years, including our own Art Starry, who's our legislative representative and has worked very hard to pass that bill to ensure that every person in Thurston County is guaranteed to have core public health services such as communicable disease, environmental health, maternal child health, vital records, and many other critical, important public health services. So another very exciting bill that the governor signed also last week of significant public health importance that we're very proud to support is Tobacco 21. So what that means is as of January 1st, 2020, the sale of tobacco and vaping products will be prohibited to those under age 21. And this is really significant in public health for many reasons, and we have worked many, many years to advocate for this because cancer is one of the leading causes of death for people in Thurston County. 27% of cancer deaths in Washington are attributed to tobacco use, and 95% of all people who smoke report that they started under age 21. So this is going to have monumental long-term health impacts on not only the kids in our community, but for the health of everyone, and will help us to continue to improve our length and quality of life here in Thurston County. So thank you to everyone for all their support of all those very important issues and for the great work of public health.
Any questions or comments? Questions or comments?
No, I think we're winding down here. Thank you
have
very
anything?
much, Shelley.
Are there other states that have done this 21-year-old tobacco?
Yes, there are many other states that have passed tobacco 21 laws, and I'm not sure exactly what the number is, but I know there's many other state legislatures that also have this under consideration for this year as well. I'm not quite the majority yet, but more and more are joining this effort.
Yeah, I believe it's over a dozen, like between 12 and 19 is what I heard.
Okay.
Do we have other counties calling us for best practices then to see how they can lift their livability and health score as a best practice, perhaps?
All of the counties in Washington State, our local health jurisdiction partners, we work very closely together and we do share best practices. We meet regularly. We share data. We share services. We work together, and there's many factors that go into those health rankings. And it's not a matter of racing to the top or being better than another county, but way in which all of us can work together to improve the health and well-being of our community, and really also call out that where you live does matter, and there are certain areas, not only within our own community, but across our state and across our country, where there's significant issues that are impacting the health rankings and the length and quality of life among those residents, and those are inequities that we need to work together to address.
Got it. Anything further? County
that's
manager,
awesome.
anything?
11 states have laws of.
Oh, 11,
21.
okay. That was a bit high.
And now will be 12 with Washington.
Beautiful.
But individual cities, they have their own laws, such as New York City, Chicago, San Antonio, Boston, Minneapolis, and Kansas City.
Okay, Vice Chair, any further business?
Thank you, Google.
All done?
Commissioner Edwards, any business?
No, sir.
No further business. This meeting's adjourned.
Thank you.